Hello, I'm back once again, Dr. May from Johnson Optometric Associates. Today, I'm going to talk a little bit about macular degeneration, what it is and how we can treat it or manage it. Macular degeneration is a disease that affects people mostly in their elder years. So it does happen occasionally in people in their 50s, 60s, sometimes younger, very rarely, but mostly this is people in their 70s and on up. Macular degeneration is much more prevalent in people of Caucasian origin. Also, another risk factor, family history, and some risk factors that you can control, smoking, UV protection, and diet. So I'm going to talk about a little bit of those things as we go along. What is it? First of all, macular degeneration is affecting the macula. The macula is what we use to focus. So the back of the eye, we'll look at a model of the eye here. The very back of the eye, the retina, that's where the macula is. Okay, so here's a picture of a normal macula. This is actually my macula. So the optic nerve in the back of the eye, and then the macula is the dark spot off to the side. And that's what you focus with. So as we age, sometimes the macula will start to break down and degenerate. Basically macular degeneration, exactly as the name sounds. With macular degeneration, you'll get buildup of deposits underneath the bottom of the retina. And that can eventually cause vision loss. When the macula starts to degenerate, it can cause issues and the tissue just won't be healthy anymore. There's certain things we can do to detect this. Firstly, a dilated eye exam is crucial because we can look at the macula and tell if there's anything wrong with it. The first thing that we'll see isn't quite this dramatic. A lot of times we'll see just small little yellow dots, and those are called drusen. And that can develop into moderate and severe macular degeneration. So as I mentioned before, there are some risk factors, so some things that you can do to prevent this from happening. So if you smoke, we would highly suggest that you stop. And if you don't smoke, then don't start. But smoking is a very big risk factor for macular degeneration. Also, protecting your eyes from UV. So if you're outside, wear your sunglasses. And then as we find macular degeneration starting, sometimes if you take vitamins, and we'll tell you which ones to use, that can really be helpful. There are two major types, dry and wet. Dry is the vast majority of people have dry macular degeneration. And that we can keep an eye on here. There's certain tests we can do in addition to fundus photography to look for changes. Let me show you real quick. Okay, so here is a scan of a normal macula. So you have a very healthy bottom layer, nice red, straight line here. And then the top layers have a healthy little dip right here. This is normal, okay? In macular degeneration, you have obstruction and degeneration of this bottom layer right here. And that's when you see these drusen. Macular degeneration starts dry, but it can turn into wet macular degeneration, and that's when you get bleeding and swelling in the back of the eye. And we can easily detect that with an exam and also with this test. I won't get into all the details of it. It's a very complicated disease, but it's very important that if you think you may have that as a family history, or if you have any concerns with your vision, to let us look at you every year. And if we find that you have macular degeneration, we usually will recommend checking you every 4 to 6 months to make sure we can notice any changes in that. If you have any questions, as always, let us know. We are so grateful that we can take care of you, and we hope that you have learned something out of this. I know it's a lot of information to throw at you, but certainly call us if you have any other questions. Thank you.